दो डॉक्टर आ गए। Assalamualaikum.
Alaikum assalam.
Assalamualaikum.
Assalamu alaikum.
Assalamualaikum, sister. How are you?
I'm very well, thank you. How about you?
Shukra, alhamdulillah. Just waiting others to show up. Hopefully soon we'll.
Yeah, no worries. Take your time. I just wasn't sure.
Thank you. Assalamualaikum, Sajjad Sahab. How are you?
Alaikum salam. How are you?
Alhamdulillah.
Assalamu alaikum.
Alaikum salam. How are you?
Alhamdulillah. आप कैसे हैं?
I'm good. You must be busy right now with the pandemic.
Yeah, it's quite challenging, exactly, because it's a lot of switching and deployment is happening between Peter Lougheed and Alberta Children's Hospital.
Right.
Yeah, just to accommodate more adults. So it's lots of things are happening, constantly changing, constantly on backup schedule for hospital, and constantly available as well.
Yes, I heard that they are freeing up some space at the Children's Hospital for adults.
They actually are, and they actually have decided to stop actually to convert PLC already to adult ward. So all the pediatrics beds have been reassigned to Children's Hospital starting next week. Sorry, would you mind if I just take this call? It's coming from a hospital.
Sure, yeah, definitely. Please feel free.
आप लोग भी बहुत बिजी हैं, लेकिन
So I think Dr. Hassan, Dr. Shibi got some last minute things, so he will join us next week. So just in a couple of minutes, we will start. I think Dr. Sakina Raj should be in any moment. And before, I think we should start because we do have 40 minutes here. And if others will join in, then inshallah we will keep, taking them as well. So, Bismillahirrahmanirrahim. Assalamu alaikum. First of all, I would like to thank you all for joining, especially Sister Syeda Abbas, and also brother Dr. Sajjad, who was us last week as well. So, and we have Dr. Syeda Abbas, who is a pediatrician working at Peter Lougheed Center, and she is dealing with the newborn babies and inpatients, and she's also an educationist, clinical lecturer at University of Calgary, also a community pediatrician at Renewed Community Clinic as well. And Dr. Sajjad, we also have introduced him to our brothers last week. He's a clinical pharmacist, a public researcher at Alberta Health Services, currently conducting research on coronavirus misinformation in Canada as well. And very shortly, we'll be having Dr. Sakina Raj joining us, who is a family physician with more than 30 years of experience. Everybody knows her as well. So inshallah, we will talk to them once they get in here. The reason of this webinar within the community, I know most of people are aware with the current situation in the whole world right now. We are dealing with this pandemic, COVID-19, and so far we had thousands of deaths throughout the world, especially in Canada, more than 9,500 deaths and 9,500 coronavirus victims. In Calgary, we have more than 530 so far. So basically this educational program, with your help, would educate some of our community members and who will benefit from this chat in the longer run, inshallah. So my first question would go with Brother Sajjad, Dr. Sajjad, in terms of how to handle the current sanitization procedure if one of the family members has been affected with COVID-19, and what would be the best way of correct sanitization procedure? How do you explain that to the audience?
Thank you very much for the question. Yes, so when it comes to having a family member or a loved one who has COVID-19, it is advised for them to stay in their room. It is advised for them, if possible, to have their own bathroom, not to share utensils such as dishes or glasses or any other utensils. If possible, you can leave food at their door and they can eat in their room. That will be the most ideal situation to reduce contact. In terms of their laundry that needs to be done, the person who is doing the laundry of somebody who is infected, it's advisable for them to wear gloves if possible, while doing the laundry in the washing machine on the high heat, and then dispose the gloves and wash their hands with soap and water immediately. Similarly, the person who is having COVID-19, they should continue with the general recommendation of washing their hands with soap and water for at least 20 seconds. Yeah, when you get those after they finished eating, maybe their utensils, to wash it again in the dishwasher, and make sure every time before you touch anything like that, you wash your hands with soap and water. Now, if it's not possible for that person just to stay in that one room, depending on living situation, maybe they'll be using a common living spaces, then it's to make sure that you disinfect those common living spaces thoroughly when they after they've left and before they sit there, and also to make sure you keep your distance within the house. The 2 meters 6 feet distance applies here as well, and for the person who is sick, to wear a mask so that they don't infect others. And that's what the recommendations right now are when living with somebody who has COVID-19. I'm sure Dr. Syeda can also elaborate in case I have missed anything.
No, I think that's a pretty detailed response. Yeah.
Thank you. And my next question, these questions were raised during the last few days, would be to Sister Dr. Syeda Abbas, actually. The question is, can children also be affected with COVID-19, and are there any special measures to take for them, such as for all kids between ages from 13 years, specialists in those ages as well? So what do you suggest, how would they be affected through this coronavirus?
Yeah, so that's a great question as well. Definitely children can be affected. I would be very honest that information about COVID-19 disease in children is quite limited. There is a big study that just came in China, unhone, sorry, is it okay to speak in Urdu?
Yeah, we can speak in both languages. That's okay.
I wasn't sure what is your targeted audiences. I think they would benefit from some Urdu as well. But what they decided to do is that they looked into children up to 19 years of age, and they represent about 1% of total, about 72,000 cases that they looked into. So children are definitely going to be affected, as well as also they have pretty much similar symptoms like fever, dry cough, and some tiredness as well. They can present with a little bit of shortness of breath and a little bit of sore throat, as seen in adults as well. But two symptoms that were prominent for children, or not prominent than what I already mentioned, but they were mostly seen in children as compared to adults, were abdominal pain and diarrhea. So tummy aches and diarrhea were the two symptoms that were more prominent in children. And then what they looked into is that infants actually were affected the most, so about 10.6% as compared to 7.3% of 1 to 5-year-old and 4.2% up to 6 to 10 years of age. So your question about can children be affected? Yes, they can be affected, and they will have similar kind of symptoms. Do we need to take special measures for them? So from physical perspective, not really, unless they have kidney problem, they have heart problem, or they have lung issues. So then the only thing that we need to do is just to be extra cautious in terms of social distancing with them. Kids who are immunosuppressed, which means that their immunity is not great, or they are on a steroid for whatever reason, they are at even increased risk. So you just need to discuss with your doctor for sure about what to do for them. But exactly as brother Sajjad said, that there is no need to wear mask or anything unless you are sick with symptoms. So the similar thing goes with kids as well. You really don't need to just prevent them from going outside, because everything else that actually boosts their immunity, and one of the things is also exercise or being physically active, applies to all of them. So I don't think that other than what we are doing or suggesting right now in terms of social distancing, as well as also ensure that you are just washing your hands really, really nicely, that you need to do anything extra, except if you have those diseases that I mentioned, then you need to just talk to your doctors about them.
So what about kids with asthma or other complex conditions, or with a low immune system for the kids? What do you suggest?
So exactly. So as I said, that kids with heart disease, lung disease, including asthma, as well as also kidney disease, they are at increased risk of getting this infection. But there is no special measures that has been suggested as of yet by Canadian Pediatric Society or Alberta Health Services that we need to take, other than just being extra cautious in terms of their care, in terms of social distancing, as well as also isolating them from the people who do have symptoms of COVID-19 disease. And the same applies for kids who are immunosuppressed as well, because they are increased risk of getting this illness.
The question is to both of you right now. I don't think we have others ready yet. So what are some of the things that we can do from home in order to help out the community deal with this virus currently? Either yourself or Sajjad, what do you have to say on that?
Okay, go ahead.
I can go ahead. Okay. I can just probably just start off with that, and then you can add, Brother Sajjad, that I think there are lots of things that you can do from home, and I could see some of the great measures taken by yourself, Brother Riaz, as about reaching out to people. I think we complained a lot about having no time, as well as also, what we can do, and then just constantly looking for things. However, we're not as proactive as some other communities are in comparison to other communities. So I would just say that, it's still you can maintain social distancing, as well as also you can isolate yourself, but you can pick up a phone and then reach out to people who actually just need you in terms of even venting, right? We need to remember that I just mentioned about a lot of physical symptoms, but we need to remember that this is an illness that is going to affect all of us psychologically, mentally, as well as also socially, because of the financial issues, because of a lot of, I am seeing a lot of kids these days with anxiety symptoms as well. So even just, talking to somebody and actually validate their concerns, because if somebody is coming to you and want to talk about it because they are afraid or they are scared about what is going to happen about all of this uncertainty, we need to just validate those symptoms, and we can easily do it while keeping social distancing, while maintaining social distancing. So reaching out, asking people for help, meaningful and supportive phone calls to friends, family, and neighborhood is very important. You can actually take part in a lot of donations and charity that is already happening. As I mentioned, that you are also supporting some, there are lots in the community that is happening. We all either are from India or Pakistan or Bangladesh, you know, or from some Middle Eastern countries. We know that they need a lot of our help in terms of money, in terms of you know, donations that we can just provide to them. So just be aware about people who are reliable as well as also doing these donations, and just be generous at this point. Stocking everything for yourself. Remember that Allah has said so many times in Quran, as well as also being Muslims and being Shia Muslims, we know that others, especially when your need even has more merits and points on the day of judgment. So, talking or yourself, maybe depending on your anxiety level, you can do whatever you can do, but it's never a so try to just help others, I would say, and then pray for everybody. I think this is the time that it's a quiet time for you, for your family, as well as for others as well. So pray and engage in spiritual activities as much as you can.
Thank you, sister. Brother Sajjad, do we have to wear a mask when we go out for groceries, or use that while we are in a public transport, or what do you say on that?
So, with the current evidence, and we have to understand something, and this is something that I try to make people understand, and as Dr. Syeda correctly said, that we are learning a lot of things as we are going, right? There's a lot of research being done, and a lot of guidelines are being made based on current available evidence. So, according to the current research, no, wearing a mask and outside will not protect you, or to the extent that it will reduce your risk by a lot. What will, though, reduce your risk of getting infected is keeping the distance of 2 meters and 6 feet. That's what's going to help you, whether you're going to the grocery store or not. Now, some of the things that you can do when you go to the grocery store is make a list of what you're going to get. You don't just go around browsing and saying, oh, maybe I should get this, maybe I should get that. This is not the time for that. Make a list of the things you need to go get. Go with a vision what you want to go and get. If you're using a cart, or if you're using a basket to put in your stuff, it's good to wipe it down, if you can, with those Lysol wipes, if possible. If you have them, you can wipe it down with that, or you can hold it with a tissue instead. That's what we are recommending right now. And then once you put your stuff, when you get back home, this is an extra precaution that you can take, that you dispose of the plastic wrapping and the plastic bag immediately. And then obviously, well, fruits and vegetables we wash normally, so that is to continue. And to wash your hands immediately after you get home. Similarly, when people ask, oh, how do we, what precautions do we take when we're using the elevator? And it's similar when you go shopping as well. Well, when there is many people over there, if you decide to go shopping and there's a long lineup, don't go. Go on another time. And when you do go to the supermarket, make sure you keep 6 feet and 2 meters away within the supermarket or within the grocery store. If you see, Riaz is buying eggs, then I don't have to go buy eggs at the same time. I can go take yogurt and then come and get eggs when he's not there. That is not the time to socialize in that area. So keeping that physical distance is very important at all times. And then when you use an elevator, for example, you press the button. When you make sure you get back home immediately, you wash your hands with soap and water thoroughly. So that's what the guidelines are right now. If ever the guidelines change, we will also be updating everyone accordingly, and we'll be getting guidance from various health agencies and public health agencies.
We have brother Shanawar already joined us. He's one of our very helpful community pharmacist. I don't think his video is turning on. I'm just trying. I think it's gonna turn on soon. One really important question we have been hearing from a lot from the community members that do we, for example, what precautions should we take if we are staying with the elderly or such as with our grandparents or grandchildren. Normally, we have a joint families here where we have an elderly people living in the same household. So what precautions should we take? Because as it's really high risk for the elderly people, right? So what do you guys suggest on that?
I would let you take on that, Brother Sajjad. I would just add a little bit about the mask. I completely agree with Brother Sajjad. And I would actually add that wearing a mask when you are not sick may give you a false sense of security. With improper mask use and disposal, because I've been watching a lot in community that people are just wearing the same mask over and again when they're going out, and that actually is more dangerous as compared to wearing a mask properly. So I'll let the other questions take you, because I usually don't deal with elderly.
Yeah, Sajjad.
Yeah, so you're I mean, you see, the thing is, if you are living with an extended family and everyone is self-isolating or everyone is at home, you're pretty much fine. And this is why right now the Chief Public Health Officer of Canada has advised that stay within your own bubble. And when they say stay within your own bubble, they mean stay within your own house, with your own if you have extended relatives, if you're living in an extended family, stay within your own bubble. And if you're self-isolating from everyone else, you're pretty good. But if you have somebody who is going out and stuff, and this is where I think if you have an elderly person, then I think the younger person should be the one going to get the groceries. That is anyway in our culture, but that also works well right now, because we know the elderly are at a higher, they are more prone to getting fatalities, not more prone to getting infected. Everyone is equally has an equal chance and equal risk of getting infected. But those who are elderly are at a higher chance of getting severe illness statistically, and at a higher chance of fatalities and death. So these are some of the things that you can do in terms of okay, going out, the young person goes to get stuff and things like that. I also want to advise that whenever possible, instead of going grocery shopping, if it's possible to get things delivered to your doorstep, some grocery stores actually do that. That will be a better option, and to self-isolate and stay home as much as possible, because that's the sure way we know where you'll be protecting yourself from the virus.
So another question just came from one of the community members. I would like to share that with you. How long does the virus stay alive on the surface? It does. It has been told that it stays on the surfaces, but they are worried about are those. Does it stay in the air as well?
Yeah. So, sorry. Is it okay if I take on that?
Yeah, definitely.
Yeah. Go ahead.
Okay. So I would be again honest that the short answer is we don't know yet. A new analysis has found that virus can remain viable in the air for up to 3 hours. And that is the best that we know so far. On copper for up to 4 hours, on your cardboards for up to 12 hours, and on plastic and stainless steel, it can actually last for up to 3 days. And that's why hand washing is the absolute thing, as Brother Sajjad said, that 20 seconds of hand washing is the measure that we can do so far. They feel it is a recently published study again in the New England Journal of Medicine, which is a very renowned medical journal. And what they said is that it seems like that coronavirus resembles like the cousin viruses, like we have seen SARS and MERS previously, which actually can stay on the surfaces such as metal, glass, or plastic for as long as 9 days. But the good thing is that if you are taking care of, the cleaning, which is, Safai Nisfi Iman hai, we all know that. So most of the diluted household bleach solutions, alcohol solution, that contains at least 70% of alcohol. And then most of the household disinfectants actually should be able to effectively disinfect against this coronavirus. And that's the Center of Disease Control, as per USA, they also mention, and Public Health Agency of Canada has actually mentioned the similar kind of guides. Dense, and then this is Brother Sajjad's field in terms of all these, areas in terms of how much alcohol and all those things. So if anybody has a specific question about which one to use, then he probably can guide best. Yeah.
Thank you, Shukriya bahut bahut. We welcome our another sister, Dr. Sakina Raj. She just joined us. I have a question, and she's well known to everybody. I don't need to give her introduction. She has been in service more than 30 years, and she's well-known physician and helping community all the time. So the question for Dr. Sister Sakina Raj is, due to this these circumstances right now, there's a lot of depression and anxiety while people are staying home. How do we deal with depression during this period when we are suffering with loss of jobs and everybody's indoors and they are out of their daily routine? Dr. Sakina Raj, आप इस बारे में क्या कहना चाहेंगे?
Assalamu alaikum. Thank you, Riaz Bhai, for organizing this. This is a very good initiative. Does it matter that I speak in Hindi or English?
Hindi, Urdu, English, any.
Okay. So I will speak in Hindi because our audience will be like Urdu. Basically, today I gave a talk on Red FM, and you can go on Red FM and also listen the same talk about how to reduce the stress in the present time. So I heard a little bit of end speech of Dr. Syeda Abbas, which was excellent. Coronavirus, I think everybody knows and have some questions, but I will keep my talk how to reduce the stress, not only in the public and patients, but also in healthcare workers and the doctors. So basically 4 things we are telling about COVID and what to do is all of you are aware of. And Alberta Health Services website is a very good resource. Check it daily to see the updates and any new instructions for us. We are bombarded with coronavirus information all over the world. So today I did, and I request all of you to exit from all the groups who are giving you a lot of coronavirus messages. Just see one website, and I will suggest AHS is very good. We are updating every day, and only once a day, make a time, see there is any special instructions for you. If you are getting sick, what you should do, where you should go, and all those. That's all we need for now. Social isolation, hand washing, using hand sanitizer, mask, everybody knows about. In quick, every time you touch where other people are touching, if you go to gas station, for example, or doctor's clinic, or you are going in superstore, try to wash 20 seconds. So count like 1 second, 2 seconds, 3 seconds, take it 20 and wash that. That's the best strategies for public, I will suggest. For mental health, 4 things to remember. One is...
Sakina hi.
हाँ जी. अस्सलामुअलैकुम हसन ज़हीर साहब. So पहली बात तो social media को आप break करें. Only keep very close relatives on it and ask them not to write about what's happening, but share some good memories and good recipes and what kids are doing and some games. Second thing is keep yourself updated, but once a day from a good site. Third thing is a good night's sleep is very important to increase your immunity. You are stressed out, your immunity is low, you catch viruses. No vitamin C or chemicals are going to increase your immunity. So taking, again, coming back to stress relief, what I have found in my patients, I actually went ahead and called my mental health patients, and I was surprised there was increase in their smoking now, alcohol if they are taking more. domestic violence was there, kids were abused. So I was getting all those histories from the patients and I was really shocked. That's why I decided to give topic on this. Kids and elderlies at home, this is the time you spend with them. I think God has given you this time. So don't let them sit on the websites and give them phone or iPads. Give them real eye contact, do some activities with them, let them clean and cook with you, with maybe some light music or some light exercises going ahead. If you are self-isolated, try to go in your backyard and have a little bit of walk. If you are not self-isolation, if weather is good, go for a street walk. Of course, keeping social distance, 1 or 2 kilometers, that's important. And then keep a healthy dish of vegetables and fruits with all colors in it. Early morning, let the kids and yourself and hubby cut the big plate. All day long, take fresh fruits. You'll get all your vitamin E, A, C, everything. And then exercise 30 to 40 minutes a day at home. Can you listen? Riyaz bhai, are you listening?
Yes.
Okay. So 30 to 40 minutes of exercise. Even we are giving free women fitness and yoga classes every morning virtually, 9 o'clock. So if anybody interested, connect with me and I'll join you with the group.
Actually,
so
that will be one of the good resources for the community members who would like to get engaged in physical activity, as well as many of our religious scholars have already advised us spiritually we can take advantage of this time, study Quran and study Nahjul Balagh and Sahifa Kamla. And on the other side of the physical activity, there should be, if you guys could elaborate on that, have more programs online or guidelines. And the Hussaini Association of Calgary has already this HAC medical task force, which you guys existed, Dr. Shabir Hassan, Dr. Fozia Karimi, you guys and others, really commendable job. And, that's a big support, moral support of the whole community. I've been talking to all the members. They thank all of you for joining that task force. And always, it's a hope. You've been doing so much awful stuff already. You guys are busy with your current situation as well. Another question has just came in. As you mentioned about the sleep would increase the immune system, and the exercise, of course. So they say, what are some of the things that we can do from home in order to help the community deal with the virus, which you have already elaborated on that.
I have, Riyaz, something to add though, once you finish your talk.
Please.
So I just wanted to end up my talk. The take-home message is get help. So if you are feeling depressed or anxiety to the point that you are blurting out or you are really irritated or is disturbing, there are resources available in Calgary. Call 811 will help you. AHS have counselors, your family doctors, you call them, they'll do your counseling. And our offices have counselors. So they will do your psychotherapy and sometimes medications needed. Do not wait till end that anything harming yourself or others happens. Get help early.
So all the participants here, they can unmute themselves if they want to. And I know today we had just a 40 minutes time in hand. So I will ask any participants if they have any questions they want to ask. Please, I will unmute everybody, but one person can speak at a time if they have any particular question to our team of doctors here.
Riyaz bhai.
Unmute, you can write it down in the chat room as well.
Riyaz bhai.
Yes.
I just want to share one more thing. In addition, AHS has this program where if you message COVID-19 HOPE to the number 393939, every day they send you a positive message. It's a good thing, and sometimes it includes links on how to deal with stress and anxiety. It's just an addition to what Dr. Sakina was saying. So I've sent it on the group chat. It's a good resource.
And also, I would like to add on here next week, the next segment we'll be having a more time in hand, and we will have our religious scholar Maulana Hadi and Dr. Shibul Hassan will join that too. And I will request everybody to send in more questions. And our brother Asad Jafri has had a really good suggestion in terms of engaging someone, and I'm looking into that. Have someone in this chat who will guide us through this financial hardships as well, how to get the government provided aids to for the relaxation for the businesses, for the households who lost jobs. Sister Dr. Syeda, do you have any suggestions for the things you would like to talk about?
No, exactly as Brother Sajjad said and Dr. Raj said that just positive. It's a very challenging time, and talk about your fears, and then your physicians are there, doctors are there to help you out. I am an avid book reader, so I just read Dr. Russ Harris's book. It's an amazing book, easy to read, practical book on how to manage the many challenges life actually presents us. So the message is stop struggling and living meaningful life. Do things that you always wanted to do with your kids, always wanted to do with your family, and just take it very positively. Read this book, especially for adolescents and teenagers, because everybody, of course, if you can benefit from Quran as well as also Najul Balagha, it's a great book. But if somebody wants to read a good book that actually leads you through this difficult time, then it's Happiness Trap is a good one. Yeah.
Riaz?
Yes.
One thing I want to add is that there is a technique called mindfulness. And these doctors can comment on that, because using that mindfulness technique, I think we can fill up the time so that it takes our mind away from all these concerns.
Yes, can I answer that?
Pardon? Yes, please.
So I will ask.
Yeah, I think it's
I will ask Asfa and myself. We can do online meditation, 15 to 30 minutes or 15 minutes every day or every week.
Okay. Well, definitely, I will get back to you guys, and really appreciate your time. And then we can definitely, work on those terms and ask people to join if they want. All we can do is provide the service and the guidelines, and it's up to the families who would like to entertain that. And there's a question from one of the sisters, I think, on the chat, and anybody can answer on that. If you guys can read it, or you want me to read it for you guys.
Sure, if you can read.
The question is, for those who are still working, can they share the workplace, kitchen, and washroom?
So if you are staying in a family and you are working, I mean, yes, you will have to, right? What option do you have? But the thing is, you have to make sure, I mean, as much as you can, not to share utensils if possible. To make sure both of you wash your hands thoroughly for 20 seconds when you enter the house. And when you are at work, to keep social distancing, because I understand that not everybody has the can actually work from home, especially if you're working in essential services. So yes, to make sure you maintain your distance when you are at work or going to work, as much as you can. And if you do that, even if you share the kitchen or the washroom, it should be fine. And if somebody is infected, then we had already discussed that earlier on what to do.
And there's a $1 million question. Sorry, yeah, yes, sister.
No, I'm just saying that washing your hands frequently and thoroughly up to 20 seconds is the answer of many, many questions.
And there's a question everybody has.
Riaz bhai, in clinic, what we are doing?
Yeah.
We are keeping distance, of course, but then we have to see the patient. I have to see the patient every day. There was like big laceration I had to stitch today. There was a wrist fracture, all those emergencies. So washing hands, of course, using mask. We have visor also. So if the patient is really sick, I have to use the whole PPE. We call it protective gears. But we are washing all the handles and doors every hour. Or we are not allowing 1 or 2 patients in the waiting room. They sit in the car. We call them when they have to. So be careful. Keep some wipes in your pocket. Whenever you are going at the grocery or gas station, wipe thoroughly your hands and also the handles and all. Even the superstore and all are providing you wipes to do that, but do your own also.
So the question everybody has, and you may have heard also, are there any vaccinations created or being created for COVID-19? Or if not, then how soon?
Great question.
This is
It always take 1 year to come. So next year, maybe we'll get COVID.
There's one another question related to it. I heard that they are saying that if the virus is widely spread in the world and it becomes, I don't know the term,
herd immunity.
Herd immunity, or if I'm not pronouncing it wrong.
Yeah, herd immunity, yeah.
So is that true?
It is. I'll let other people say, but see, it is true, Riaz bhai, but thing is, if you get the infection fast and it's very crucial, or you get severe respiratory distress, then nothing works. So neither vaccine will be effective, neither herd immunity. Everything in theoretically is possible, but such a serious kind of infection, virus, and so many deaths, everything, this can come next year maybe, but this year we have to be careful to flatten the curve. Okay. And it lies on population, patients, and us to flatten the curve in next few months.
And also the question is, if God forbid in the community or anybody else is carrying COVID-19 and he's positive and he's in the same household, how would other family members would isolate themselves, without showing that to that positive carrier that he's not something which they want to be away from, just within the social limits. How would they stay away from that virus, but still giving moral support in the family or while they are staying together?
I think one of the things, first, let me just address the vaccine question. And Dr. Sakina was right. And just to add on that, the vaccines, there's currently research being done. The government of Canada also is giving funding to a lot of research, as well as the governments of many countries, including the World Health Organization. So there is research being done, and it's being done at a very fast pace than normally done for vaccines. However, it is going to take a minimum of 1 year to get a vaccine. And Dr. Sakina was right that the only method right now we have is social distancing and hand washing in terms of preventing ourselves from getting the virus and protecting ourselves. In terms of somebody isolating, and we did answer this question a number of times, to add to your addition in terms of how do you not make somebody feel isolated. I think in addition to what Dr. Sakina said in terms of maintaining mental health, and she or Dr. Syeda can go on with that, is you can maintain physical distance in the house. If somebody is in their room and the door is open and you're sitting in the sitting room and you can see them and talk to them, there's nothing wrong with that. It's just that you have to maintain that distance. And this is why we use the word physical distancing a lot rather than the word social distancing these days. Because it's not that you cannot be social, you cannot interact. We need to be more close together as a family, as a community right now. We just can't be physically together. Within your own family, if nobody is suffering, you're fine. But generally with other community members or with somebody in the house who is suffering, you can't physically be close. But in terms of being social and being together, yes, of course not. Of course you can give each other emotional and moral support.
Well, Brother Sajjad, you are doing currently the research on the coronavirus, the misinformation about coronavirus in Canada through Alberta Health Services. So
Riyafi, can I just say one thing? Sorry.
Yeah, please. Yeah, go ahead.
If you are isolating at home, Sajjad bhai said very rightly, but you have to keep your utensils, cups, and glasses separate. Wash them separate with hot water. clothes also in very, very hot dishwasher and keep it everything separate like we do. Whenever we have cold, we do that. तो आपका गिलास अलग रखो, आपका cup अलग रखो. So make sure. And if you are coming out or talking, there's no harm in keeping a mask on face. If you have.
Like, as you guys know that Hussaini Association of Calgary, the religious events and programs were canceled due to the public gatherings, but we know we still have to provide the online services to the community at our best. But as for this 6 feet or 2 meters separation, physical distance, and now with the shelter home, the government and Dr. Hinsha has just announced it, instead of 2 meters, they can just keep 1 meter because of their structure of the bedding, whatever it is. So if people maintain that 2 meter distance in a physical distance, so is it still safe without touching, without, you know, hugging each other? At least a few, 4 or 5 people together somewhere with a social physical distances. Because there's a lot of fear within the people. Husband doesn't want to welcome, wife doesn't want to welcome husband, husband doesn't want to welcome wife when she comes from the work, and you know, there is a different kind of fear among the families. What do you guys have to say on that?
See, what is you have to have a little common sense. If you are having symptoms, of course, you'll be more stringent, right? Otherwise, as I came, I am wearing 3 layers. So I took off my yellow gown, then I took off my white gown. When I came home, I changed my clothes, I washed my hands, and then also kind of cleaned your mouth and skin surfaces, and then you are fine. But if you are having symptoms or you are positive COVID, that is a little bit more stringent. For the Hussaini and all, I don't know, Riaz bhai, we have to really be careful this month.
No, definitely. We don't have any programs there. I just give that an example. I mean, even in the household, we are like 4 family members, 7 family members. It's the same, I think the same guidelines for every gathering, either it's 4, 3, or 6 to maintain the distance. So
at home, no need to, like we are praying together, we are 6 people and nobody's sick, we are working together, we are eating together. I don't think you need that distancing to your close family members unless they are sick.
Exactly. Yeah.
Yeah,
Dr.
exactly.
Sakina is right.
Yeah.
That's why the Public Health Agency of Canada said that you have to remain in your own bubble. So you and your family, that's your bubble. As long as no one within your own bubble is sick, you are fine to be with your own bubble. Dr. Syeda, you can go ahead.
Yeah, no, exactly. I exactly wanted to say what you just mentioned,
yeah,
that people
definitely.
need to
There was
understand
sister just asked a question in terms of the fasting. I will just elaborate on that. Any obligatory Islamic duties are not abandoned, they are still valid, but there has been some changes in terms of if somebody passes away with a virus, the doctor suggests that the washing body is not permitted. Our Marajas have allowed us to do the tayammum, and there is of course with the guidelines. So there are different guidelines. Inshallah, Maulana Sayyid Hadi will be with us next week to answer some religious questions, and definitely join us next week, and we will have more time in hand as well. And individually, Sayyida, Sister Sayyida, Dr. Sakina Raj, Dr. Sajjad, do you guys have any message to our community members, the families, youngsters, in terms of how to take care of the time when they are free in the house, in terms of to get themselves not involved in the anxiety or get in any kind of negative feelings?
I would just finish exactly on that note what I was about to say, on the same note as Brother Sajjad was saying, that we don't know how long this is going to last, right? So just to be prepared in terms of a new norm for right now, right? And I think that is the best thing you can do, just to accept that this is a new normal in terms of your physical limitations, in terms of your own bubble. And as soon as you will just realize that, because I completely agree with your comment, Brother Riaz, about people are really, really scared, and among the family, they are having all of these issues as well. So once you will realize that, your mind will come at ease for sure. You will have better mental health. You will just learn new ways of dealing with kids around home, as well as all you working from home, and all these uncertainty, because we just don't know how long this is going to last. UK has suggested May 2021. Some other countries have suggested maybe 18 months. So until we don't know, we just need to just come up with something. And then I want to say one more thing, that because I've been hearing a lot from my patients that they feel that the family doctors are not available, or the specialists are not available in terms of close. They're only closed in terms of seeing patients that are not needed to be seen. So non-urgent patients. For urgent issues, we are available and we are working at the front line right now. So please call 811 or your family doctor if you have any concerns, or you can also call a specialist if you're linked with one, if you have concerns or questions.
I'll just add to that, and then Dr. Sakina can finish, because that is her field. So when it comes to mental health, I always tell people, be in the moment. Thinking when it will end, as Dr. Syeda said, or thinking, when will this go away, will not be helpful. Stay in the moment. Think of what you can do today, what you'll do tomorrow, what you'll do next week. Don't think when it will end. The other thing also is to remember that we have this time to do a lot of things that you might have wanted to do, you didn't do. To maybe start your hobbies, to catch up on reading and all these things. And I think we need to be together close as a family, as a community, more than anything at this time. I also want to add something. If anyone feels they have symptoms of COVID-19, please call 811. Do not go to the hospital. That is not advisable, as you will be infecting other people. If you have an emergency situation where you can't breathe or things like that, then you call 911. But if you have a fever or cough or flu, you call 811. You do not go to the emergency department.
Okay. Let me finish the talk and give to Riaz Bhai. I'll finish with some of the readings I was doing for Daily Wisdom sent by Marzia, our sister Marzia from Toronto. They said, set up intentions. So when you wake up, it's not that what we are going to do and no planning. Don't get out from the wrong side of the bed. Don't get up grumpy. Okay, so think of a brightness in the day and think about some intentions. Intentions can be, for example, I intend to be kind today. I intend to keep my sense of humor. I intend to take myself lightly today. I will not get irritated or angry. I'll take things lightly. I will practice self-compassion today. I'll call few people, friends. I'll help, charity, whatever. I will notice the beauty around me. I will show up with presence, gratitude, and courage. Setting up intention doesn't mean that we always will live up to it, but at least remind yourself. Set up a list of the day, how you will set it up, so you will feel grateful plus thankful to Allah to have passed the day with kids and family peacefully.
Thank you so much. Thank you so much, all of you. I personally, on behalf of Hussaini Association of Calgary, our community, thank Sister Dr. Syeda, Dr. Sajjad, and Dr. Sakina Raj, and all the viewers, whoever is here. Inshallah, I think regarding this time, and we'll share it with the rest of the community members, and hopefully they will benefit from your talk. And inshallah, we will get back next week with more information. I think Maulana Said Hadi will join as well, and we'll have one of the financial guy joining us to help our community to answer their questions in relating to the layoffs or some of the small business or the larger business. They are closed right now. They are having a lot of hardships financially, how to avail the proper connections through the financing or the support from the government. And I would really once again thank you all. And if anyone has a final message for the community, please feel free to say. And I think Brother Shanawar was here, one of the pharmacists, always helpful. And I think his video didn't connect. But if Brother Shanawar, you have to say something, please feel free. I think his audio is at mute.
So Riaz bhai, I'll just say that anybody who's sick or have a question, call their family doctors. If they are not available, call us and we will guide you through. Also, we can send your prescriptions to pharmacy to be delivered at your home. I think Shanawar bhai is good at that too. So in Northeast area, Southeast area, we can send Shanawar. And here in Northwest and all, we have our own pharmacists. So don't be afraid. Don't call 811 all the time because you will not be able to get through and you'll get very frustrated. So get information from us if you cannot get through 811 if you are trying.
As everybody in the community, in our community, our Iraqi brothers, I think everyone in the Calgary knows that the HAC COVID-19 Task Force, which has the names and the phone contact numbers of our respected generous medical team there to help. But I would request all the brothers or sisters who need assistance, as Sister Dr. Sakina said, if you don't get contact with anybody else, call those numbers, but make sure if it is urgent and we don't need to bother them while they are busy dealing with their own personal stuff, and they're already doing a lot to the community. So really appreciate that if you have your...
They can actually, Riaz bhai, sorry, they can go on sehatclinic.ca for me and write a request there. So my staff will call them right away.
Thank you. Jazakumullah.
I don't know about other doctors, but this is sehatclinic.ca. Even if you are not our patient, we can see you as walk-in, or I'll call you, or my other doctors will call you.
And also Brother Shanawar, he's a pharmacist. He has his own pharmacy, and it's always to help, as Dr. Sakina said, that if people can't get out of their homes, and Hussaini Association of Calgary Executives Trustees are always there to help you deliver the groceries or anything at your doorstep. And there's also Al-Qaim Charity Foundation helping with the COVID-19. Those who are in self-quarantine or self-isolation and they need a free food delivered at their home, no worries. And inshallah, with the help of Allah subhanahu wa ta'ala, the most and foremost important thing is have a tawakkul on Allah subhanahu wa ta'ala. He's the one who gives shifa. But we have to follow the guidelines by the medical team and the health officials. May Allah bless you all. Thank you so much for attending, and inshallah we will get back next week. Till then, stay blessed and stay home. And jazakumullah khair, everybody. Thank you.
Thank you, everybody, for listening. And Riaz bhai, Allah will give you jaza for doing such a good job.
Thank you, everybody. Thank you, Dr. Syeda.
Thank you very much, Riaz bhai.
And all the viewers.
Thank you, everybody.
Thanks. And